This is Dr. Sivanvesh. He is our critical care and emergency medicine specialist. Today we are here to discuss about golden hour in brain stroke. We have three windows. The first window is in 4.5 hours, the second window is in 6 hours, and the third window is in 24 hours. Around 15 million people suffer from stroke all over the world. Now listen carefully. These numbers are shocking, but believe me, that is the truth. Of these 15 million people, 5 million people will die, 5 million will have severe disability, and the last 5 million will partly or significantly improve. Every 4 minutes, one person dies of stroke in the entire world. Unfortunately, stroke is rapidly increasing in third world countries due to changes in lifestyle, food habits, climate, etc. In the developed countries, there is decrease in incidence due to awareness and preventive measures like exercise, diet control, and control of the disease itself. Brain strokes are the first common cause of disability in the world and second most common disease to kill a patient. A stroke not only affects the individual, he in turn affects the entire family, as one of the family members has to attend and sit with him and assist him on bed and help him on day-to-day activities. And due to medical physiotherapy expenses, economically the patient family takes a strong beating, leading to financial breakdown. Sometimes these family members get tired of taking care of you for long years, and I will leave the rest for your imagination. So prevention of the disease is better than depending on others for living.
Stroke is nothing but sudden loss or reduced blood supply to a certain part of brain, leading to depletion of oxygen and nutrients to brain cells, leading to death. There are two major types of strokes: ischemic strokes, which are 85% of all brain strokes. They are caused by a blocked artery due to fat deposits, cholesterol plaques which rupture and cause blood clot. The clot forms either directly in the brain or from elsewhere in the body and travel to brain, causing brain stroke. Hemorrhagic strokes constitute 15% of brain strokes. The blood vessel ruptures and blood directly leaks into the brain, causing compression, inflammation, and increased intracranial pressure, requiring surgery like craniotomy and craniectomy. Those patients are shifted to neuro ICU and prepared for surgery immediately. Time is brain, brain is time. In first window period, golden period for brain is first 4.5 hours, wherein clot busters like a tissue plasminogen activator are given costing around 35,000 for dissolving the clot. The first 1 hour is the best period. Always remember, people treated in the first 1 hour have better outcome than those treated in second, third, fourth hour. Whatever hour they walk in decides their recovery. Window 2, in 6 hours, wherein patient based decision to give clot busters are a procedure called mechanical thrombectomy, where we remove the clot using cath lab, a procedure similar to angiogram. Window 3, in certain cases the treatment may be given up to 24 hours based on the patient condition. Always remember, every minute is important, as around 20 lakh neurons die every minute, which is irreversible, and clot busters can only save the rest of the brain from dying. Suppose you take entire Vizag city population, around 20 lakhs, imagine it being wiped from the map. Similarly, in your brain, every minute you delay in reaching a hospital, one Vizag city is being dead. That is why it is important to reach a stroke ready hospital which have clot busters ready with a professional stroke team. We at GEMS have a robust program designed by our eminent mentor Dr. Bullen Bhaskarrao sir, which includes a stroke code to call a stroke team 24/7 ready. The team is qualified with expert doctors, nurses, practitioners to help a stroke patient. When the stroke patient reaches the emergency room, the code is called and stroke team immediately responds, attended the stroke patient and evaluate the patient in 5 to 7 minutes and stabilizes him with necessary problem based medication. The team then shift the patient to the radiology where a CT is done, because it is essential to differentiate whether it is a clot or bleed, because both have different treatment protocols and if wrongly administered will endanger the patient life. Stroke team walks in with the patient right into the CT. This may not happen at others, but this does happen at GEMS, as it is a stroke center. If there is a clot, the team immediately start the clot busters medication on the CT table after obtaining proper consent from patient attendants and shift him to neuro ICU under neurophysician care. This is all done 20 to 30 minutes. So, if you go to a place where there is no MRI or CT facility, is like killing yourself. Who are the persons at high risk for stroke? Hypertension patients, diabetic militants and smokers, gutka, kidney chewers, alcohol, obesity, poor physical fitness, coronary artery disease with atrial fibrillation, anger and family history of stroke disease. The brain stroke are now being seen in all age groups, especially even in above 25 years. Previously, it was seen in only above 60 years of age. Imagine if you get a brain stroke at age 40, what is your future? Change your lifestyle, habits, and prevent it. What are the signs of stroke? The slogan to save stroke patient is be fast. B for balance, that means balance loss, dizziness, unable to walk, falling down, drowsy. E for eye, sudden trouble seeing, decreased vision. F for face, deviation of angle of mouth. A for arm, weakness of upper limb or lower limb of same side or opposite side. S for speech, slurring of speech, trouble speaking or not understanding other speakers. T for time, to call 108 and reach a stroke ready hospital that has CT or MRI in it. Coming to rehabilitation phase, it includes physiotherapy, muscle stimulation, speech therapy, swallowing therapy, cognitive rehabilitation, Botox injections to loosen muscle stiffness, transcranial magnetic stimulation. Please remember the golden hour in brain stroke is 4.5 hours. First hour is being the most important where you have good outcome. For mechanical thrombectomy, it is 6 hours and rare cases up to 24 hours. So remember, GEMS is placed strategically in the district that you can reach GEMS within 4 hours from any corner of the district. Remember, only 30% of brain stroke patients recover fully, 30% die and 30% partially recover. You need extensive rehabilitation which is available at GEMS. So please share this video so it can save somebody life, and please choose wisely. A teaching hospital like GEMS where all facilities are available. Thank you.